Good evening and welcome to my Instagram live this evening on Saturday. So we're Saturday Night Live with me, Dr. Chytra Anand. Today I have a dear friend of mine from Denver, Colorado, Dr. Joel Cohen. Dr. Joel Cohen is one of US's top dermatologists. He has also been on a lot of TV shows in the US. He's been on an Emmy Award winning show called The Doctors. He's authored over 255 articles, medical journal articles, and that's no easy achievement. He's also got textbooks to his name, and he's also done numerous appearances on TV show. And he's an expert on everything laser oriented. There he is. Hi, Joel.
Hey, buddy. How you doing?
Good, and how are you?
Fantastic. Thank you.
So it's 10 a.m. in Colorado, Denver.
It is. It's a
Fantastic.
beautiful day here. How
I
about
know
you?
that you like hiking and trekking. So is this one of those weekends where you're going trekking and hiking?
I hope so. I hope tomorrow. Yeah, it's been a busy week, but what are you up to?
Well, it's Saturday night for us, and so I'm here chatting with you transcontinental.
Very nice. Well, it's good to see you. It's been a while. We hung out at Cosmetic Surgery Forum in Nashville before we even knew what was going to happen in a couple months. So,
I know. December. We were in December at Nashville, and now look where we are. My goodness gracious.
wow. I haven't left the house very much other than work regularly, but haven't been on an airplane, haven't visited with very many people at all. It's been, tough for everybody.
Yeah, same here, same here. I haven't been anywhere really, except like last week we took a week off to take my son for a mini break, but that's about it.
We rented an RV for fall break for my kids, so we'll see how that goes.
Oh, that's a great idea. And US is a great place to take a RV out anyway.
We have so many beautiful national parks, and my kids are different ages, so some of them have seen and some haven't. So we're gonna
Mm.
hopefully enjoy some new places for them.
Excellent. So I have a bunch of questions that have been sent already to ask you because when I posted yesterday that you're joining us, people were like, "Oh, I've read Joel's textbook on botulinum toxin. Someone had read your other papers, and everybody knows of all the tremendous scientific work that you do." So,
Thank you. I'm honored to be talking to you, buddy.
oh, thank you. So let's do this. So skin of color, right? In India, we are what we consider as skin of color. Would you say that lasers used for Caucasian skin in your practice in Denver would be a little different from the lasers that we would have to use in India, or could we go away with the same laser?
I honestly, I take care of a lot of patients of different skin types, and among the skin types, we can use certain lasers. So thulium, the 1927 laser, is
Hmm.
something that really transcends all skin types. And for people who have pigment issues like melasma, we can really effectively use that type of wavelength with a low heat to really give
Hmm.
them some improvement without the downtime of chemical peels and without the risk of post-inflammatory hyperpigmentation. And actually, you can supplement that with laser-assisted drug delivery with tranexamic acid. So we've had a great experience in our practice of using it. So, there are companies like Lutronic that makes the
Hmm.
Lace MD Ultra,
Hmm.
and then Cyton who makes the Moxie. And these are 1927 wavelengths. And it's really exciting to have something that's truly versatile for photo damage, pigmentation, as well as, interestingly, from the FDA here's perspective, it's actually approved for actinic keratoses as well.
Right. So let's talk a little bit about the thulium laser because thulium laser, very few practitioners in India are still using thulium laser. So can you talk a bit more about the technology?
Sure. So this is, first of all, non-ablative. So it pokes little holes in the skin, but the skin is not vaporized. So there's no
Mm-hmm.
wound, there's no real downtime. Patients are a little bit pink for a day or
Mm-hmm.
so. And then really where the little columns are poked into the skin, they have a little bit of dryness for a couple days after that.
Mm-hmm.
With any laser, if somebody has melasma, that type of pigment, you know, in certain specific areas. Some people call it pregnancy mask, but oftentimes we see it on the forehead, we see it on the cheekbones and the upper lip. You know, we want to make sure that we're using really, really low heat with these types of technologies, because that is something that could actually flare melasma. So you can really tailor the thulium laser, the 1927 wavelength, down so that you're just doing passes with very little heat. You're poking holes into the skin using that specific 1927 wavelength. And with the laser-assisted drug delivery of tranexamic acid, it seems to be very effective. So tranexamic acid is something where there's been a lot of attention. You and I have spoken about it.
Yeah.
And, you know, your experience is obviously very, you know, important when it comes to using this. I just use it topically, and I just screen for people and make sure that they have no history of having any blood clot history. So how do you use it?
So we use it topically, and then we also used to actually for a long time inject it intradermally into the area of melasma. But we found that there was more post-inflammatory hyperpigmentation by doing this. So I stopped doing that, but we use it orally. So we use 500 milligrams once a day. I used to use 250 milligrams BD, but we don't get 250 mg anymore. So I use 500 mg OD once a day oral for up to 6 months, sometimes up to a year.
So, you know, our friend Vivian Bukai is one of the experts on the whole realm of tranexamic acid. And, you know, from an oral supplementation standpoint, you know, there's some people who have really needed it and just to keep their melasma under control. But I think it's very interesting for some of these people who are really very compliant with their skincare regimen, very compliant seemingly with sunscreen, that they still have had melasma flares over time. And I think every dermatologist would love to, you know, find the cure for melasma.
Sure.
But the reality is that patients do have to be a co-participant in care. And, you know, there are patients that I truly believe they are being compliant with everything that I'm asking them to do. And it seems that blue light has actually become a center of attention, where some people who are diligently wearing sunscreen with zinc or titanium, they're reapplying that sunscreen every hour or two, and even more frequently if it's swimming or sweating and wiping things off. And they're coming in for treatments, whether it's light chemical frost, peels, or thulium. They still have times where they flare. And, you know, if people really think about what they do every day, I think that the blue light issue is real. And I have a new video segment now that we're not having live meetings to replace the modern aesthetic and TV and derm tube that you and I have done together. And it's called Scientifically Speaking. And I just interviewed the woman who runs the FDA sunscreen division, Dr. Teresa Michelle, and that's online, as well as Dr. Steve Wang from Memorial Sloan Kettering, who's written a book on sunscreen, melanoma, as well as nanoparticles. And it's interesting, I learned very recently that unless the sunscreen is opaque, you're not actually getting very much blue light protection. So we spend a lot of time sort of working with patients to find sort of that transparent zinc that's going to work well for them, that they're not going to be bothered by it. But in actual fact, they need to actually have some evidence of some opacity to actually protect against blue light if it's zinc or titanium. So I think the ingredient, specifically iron oxide, has gotten a lot of attention recently because that actually is something that blocks blue light very well on its own and does not have to be opaque.
That is true. That's so true because, you know, everybody is like, oh, I don't want this residual feel. I feel like my skin looks patchy or it feels so heavy. Give me like a more translucent sunscreen. And that's what everybody talks about, right? Non-residue, non-touch feel or silky feel sunscreen. And in fact, blue light, especially today, because everybody's online and that's where a lot of the blue light is seen. People don't realize computer time, iPad, phone, everything's blue light.
Right. You know, so I think that the thulium laser plus the laser assisted tranexamic acid has for us been transformative. And I will say that it's very important, you know, when we have the discussion about laser assisted drug delivery or even microneedling, when any device or mechanism is poking holes into the skin. You know, one of the major concerns is that whatever you're topically applying afterwards is actually safe when it's put at a point that's deeper than the surface of the skin, because some of these things actually are eliciting some sort of response in the skin when it's penetrating that far. So, you know, it's important to find a formulation that has been tested to be underneath the surface of the skin. So we use a specific solution that comes from the specific laser company, Lutronic, that actually was designed to be used with the laser. And I think there's other formulations for other people out there, but I have seen people who have gotten what we call a granulomatous response, where they have a laser procedure, somebody puts something on there like a vitamin C cocktail or something that was meant as a cream with a lot of different ingredients in it, and they applied it right after the procedure, it got into the skin, and then for a while they had this granulomatous response and this sort of allergy or sensitivity, and on biopsy that's confirmed. So I think we need to be very careful when we talk about laser-assisted drug delivery or even microneedling-assisted drug delivery.
That is so true, actually. You're right. How do you prep your skin? Like if, let's say, they have a skin of color, how do you prep their skin before laser services for any kind of skin laser?
You know, honestly, I really make sure patients are on board with sunscreen and sun protection. I won't start a procedure, you know, in somebody, especially somebody who has type 4, 5, or even 6 skin, if they're not being photoprotective. So looking at their face and then looking at, you know, sort of their upper inner arm, just to see if that, you know, the shades are similar. And I want to make sure that they don't have any major events planned afterwards where they're going to get a lot of sun. So we, living in Colorado, we have a lot of Iron women, Iron men athletes. The Olympic Training Center is here in Colorado. And if I don't ask the question, I might not elicit the answer that somebody's training for some big event and they're getting a lot of sun exposure. So this may not be the time to actually do a procedure because, you know, it may be unavoidable. So some of these people that do Ironman, you know, they're great at using sunscreen, you know, but by the time they get on their bicycle after the swim, they've wiped all that off. They're not going to reapply the sunscreen, and they're certainly not wearing a wide brim hat when they're wearing their bike helmet. So we have to really think about these types of things. And then from a topical perspective, if somebody has a history of post-inflammatory hyperpigmentation, you know, then I will, oftentimes if they have a picture of that, then I'll sort of see the areas that they were prone. You know, we could use a little bit of a hydroquinone ahead of time, but I'm not a big hydroquinone user. I actually like to use the things that I give patients that I feel confident that even if they don't come back to see me for a while, that they're not going to cause any problems. And I personally have seen exogenous ochronosis, which, to explain to folks out there, is a paradoxical reaction. So you use something like hydroquinone enough, and instead of making the pigment better, it actually causes the pigment to be much worse. So I try to avoid hydroquinone.
Thankfully, I think we've not had too many exogenous ochronosis in our practice at all. But also because I think we're also so particular that our patients use it in the right way. And we try and ensure that they don't use it in the daytime, but use it at night. And then they're photoprotected during the day for sure when they're using the hydroquinone. And I always try and use like a carrier in there, like a penetration. Like I always get them to combine it with a glycolic acid or a lactic acid preparation so that the molecule just doesn't sit on the surface, but actually penetrates to the deeper layers.
So, you know, the patient that I saw very recently, about 2 weeks ago, and I'm happy to share the photos with you, had been using an 8% compounded hydroquinone product for 3 years. And she was given it by a non-physician who somehow didn't, you know, give her the instructions about it, or the patient said there wasn't instructions about it. But this is really troubling because for this patient, all they did was, you know, keep applying it. They saw pigment, they kept applying it, it got worse, it spread out. And, you know, it's quite problematic, and we can make things significantly better. And, you know, it's only 2 weeks in, but I'm really trying.
Yeah, but you know, I never crossed 6% though in my practice. The highest I ever use is 6%. And for maintenance, I use anywhere between 2%, typically to 4%. I never have crossed beyond 6. And I've seen that a lot of reports when they talk about achronosis comes with 8% and sometimes even 10%.
But this was for 3 years too, just ongoing.
Wow.
Yeah.
My God,
So
that is so sad though. That is so tough and so sad. So, do you get a lot of laser hair reduction procedures back in Denver?
we do, and you know, I'm excited that we actually have a new laser for this, and I'm interested
Really?
to see what your experience is. But we have the Cocoon platform. So the Cocoon platform is something where you can actually treat darker skin types. So we have East Indian descent patients, we have Hispanic patients, and we have a lot of folks out there who, over the past couple months, have really been enjoying the success of this laser, which
Mm-hmm.
is allowing us to use 4 wavelengths. So we can
Mm-hmm.
use 810, 755, 940, and
Mm-hmm.
1060. So by blending these wavelengths, we can actually have sort of the best of both worlds. So the diode 810 is really the mainstay of the treatment, but we found this to be very fast, not painful at all, and
Mm.
very effective per treatment session. And I'm really excited because I think this is a major innovation for us. And the ability to treat darker skin types safely and effectively is huge. What about you?
So we have the multi-platform. I have different lasers. So I have standalone diodes, standalone Nd:YAGs, and then I have the combination where I have a diode, Alexandrite, and an Nd:YAG, all the triple wavelengths.
Right.
Again, it's like in motion technology, and we have like the ALMA laser group. So it's like ALMA Platinum and titanium and all these names that they give them, but it's basically the same thing. It's in motion technology, which is really fast and really literally painless. Actually, you could just sleep through the procedure compared to like 15 years, 20 years back where you would feel every penetrative shot.
You know, that's such an important thing because the technology gets so much better. And, you
Yes.
know, sometimes we see patients who are interested in a procedure, but they say, you know, I tried that, you know, many years ago and it didn't work for me. And you ask them about it, and it may have been 10, 15 years ago, and the technology is totally different. And as you said, you know, now we have technology that's in motion. So something is literally moving as you go. We can treat legs in 12 minutes, where before it took
Yes,
us an hour. And it's, you know,
actually.
for these people, you know, everyone's busy. Nobody wants to be sitting in an office for an hour plus, and nobody wants to be experiencing discomfort. So really, if you back up, you know, we have more candidates because these lasers have gotten better, and we can use them on different skin types, including darker skin types, where treatments are much less painful and painless in many respects. And then you see a lot more efficacy per treatment session. And it just sort of builds confidence for these people. And one person tells another person, tells another person. And all of a sudden, a procedure that's been out there for a long time, like laser hair removal, gets very, very busy. But the important thing is where people are doing price shopping and they're calling my office and then the spa
Yeah.
down the street and then somebody else's office, they're not making apples to apples comparisons. They're not thinking about the laser itself and the equipment, which better, newer is certainly oftentimes, you know, more effective for the patient. And they're not thinking about the level of training of the operator. And, you know, for some of these places, somebody may have just gotten trained, just started
Yeah.
using it, very little experience, and doesn't know sort of the ins and the outs of things, which is, you know, potentially problematic.
That is so true. And you see, for you, you practice in the States, so everything has to be US FDA approved. Whereas in India, there's no parameters that need to be followed. Like there's no basic parameters. So you've got a clinic like ours, which uses only US FDA approved technology, which literally costs like an arm and leg. And then you have down the road another clinic that has like a Chinese version of the laser, which was like maybe like 1/20th of the cost of this laser. And that's what people don't realize. They're just price shopping and they don't realize the efficacy is important, the safety is important, and the training of the practitioner is very important because it's not just the laser, it's the person who's doing the laser that also matters.
And we both know that, you know, obviously the equipment is so important, and even if it's, you know, something that is regulatory agency approved in some country, you know, the FDA scrutiny is very high. It takes a very long time to get an FDA approval. And I commend you on that sort of bar that you've really set of using FDA approved devices, because they are more expensive in other countries, but that's the standard that we have. And then there's what you said, whereas, you know, just because you have a device doesn't mean that you actually have appropriate training on it. And I'm sure you see this in India. We certainly see it here, where somebody uses something for a, you know, couple patients, somebody's on a Zoom call with them or standing over their shoulder in a non-COVID time, and they get a certificate, but a patient doesn't know what that certificate actually means and how much, you know, really experience somebody has training on that, and if they understand the nuances of things. You know, one of the things that has happened in cases that I've seen is that people come in and they actually maybe have their baseline visit when they're not tan, and then they come back for another treatment a couple months later, and some operator looks in the chart and then looks what they had last time, doesn't actually look at the patient and say, wow, your skin's pretty tan, you know, we should probably cancel the procedure. And if it's not that tan, maybe we should back off on the settings quite a bit. And that is something that, you know, if you're not doing that, you can really get into trouble and cause, you know, a burn, because the pigment, as you and I both know, you know, is the target. It's the chromophore, and that's a distractor to the hair follicle.
That is so true, actually. You know, it's funny because for the longest time, they hardly had any studies on skin of color when they used to launch lasers, and there were no settings. So all the settings that the laser companies give you for protocols would be written on Caucasian skin. And I remember that my clinic chain actually was the first one in the world to conduct trials for Alma when they launched the Soprano eyes. Actually, we got it for 2 years before they even launched it into the market. And we wrote the protocols for skin of color. So I always train doctors and I say that, you know, the companies can give you protocols, but you've got to use it yourself and do a few patients and then titrate it and modify it to suit your own clientele. And you've got to personalize it to your practice and the population of your patients.
So I just wrote an article. I'm on faculty at UC Irvine. So Chris Zachary and Kristen Kelly's department, which is a very well-known laser institute as well. It has the Beckman Laser Institute. So I spent some time there. I'm on faculty there. I'm an associate clinical professor, but I do a lot of projects with the residents and a lot of online teaching right now. And, you know, over the past few months with the residents, we've written several articles where I identified that, you know, these are areas where we should do a review and we should really make it very clear to people, you know, from a safety perspective. And that's one of the things that I'm interested in. And my wife, who's a pediatrician, has given me the name Safety Joel. So every time, you know, something comes up, you know, my kid's on the driveway with a scooter and they're not wearing a helmet, I'm like, stop, let's think about what could happen. So my wife is much more relaxed individual than I am. I'm the uptight, crazy person in our house. And she calls me Safety Joel. So, you know, from some of the articles I've written, really safety is a focus. And when you think about safety, you know, we just wrote an article about eye protection during laser procedures. And, you know, it's interesting, if you look at Instagram and other people's, you know, sort of posts, you might see something where, you know, somebody may be treating with external glasses, veins and vessels like on the upper eyelid or inside the orbital rim, but just have external shields on. And we know that there are potential issues with that, like keyhole deformity, where you can actually change the shape of the pupil. So I wish there was a more centralized way for people to actually have training in laser procedures. And I think it's important that we identify issues very clearly through some of these articles and works, sort of educate everybody out there about safety.
Very true. That I agree with you wholeheartedly on that. Now, tell me about HIFU. High intensity focused ultrasound. It is like the new baby on the block, and everybody's talking about it. And of course, you know, it's been around for a while for skin tightening, rejuvenation, but some people are trying to use it for melasma treatments. Do you have any experience with that?
So, you know, high intensity focused ultrasound is a really exciting area of cosmetic medicine, really. So, people have used that technology for various types of things. And, if we think back to ultrasound and imaging when somebody is pregnant, you can actually see a lot of detail. So with using this type of technology for skin, it's not just visualization where you are able to see what layers of tissue there are, but you can actually use this to modulate heat delivery and energy delivery to those specific layers that now you can see. And that causes some tissue contraction. So, when you do this, obviously the temperature is important, but that sets up a whole cascade through the energy of some of these mediators that can cause tissue contraction and tightening. So if you think about, putting a piece of fish or something on the barbecue or meat on the barbecue, there is that initial sort of kind of contraction. And that's actually what, we're seeing, but it takes a while for that to happen because we're not using extreme temperatures. We just want to raise it to a point where it's safe underneath the surface of the skin. So those mediators take over a course of a couple months. So I'd like to use microfocus ultrasound for people along the jawline for jowling. We use it for elevation of the eyebrow and, for some of these people who have some redundancy here too. But we also use bipolar radio frequency, and there's different types of radio frequency that's out there. So we use bipolar radio frequency, a device by InMode called Evoke, which is you wear like a little helmet and you do 4 treatments, and along the lower face, it really helps contract. So for some people who you can't see their jawline definition, after they've done 4 treatments, you can see it. And then, the synergy between using different energy, the microfocused ultrasound, as well as the bipolar radio frequency, they work differently, but you can have a really synergistic type of result. And I think there's a lot of excitement. And I will clarify, this is not surgery yet. These are not results of surgery. So surgery for people, if anybody comes in and they're like, I really want to do this, then I just say you need to have surgery, because what I can offer you is not a home run. This is a home run for laxity. And if I can't do that, then I'm not going to tell you. But there are people who come in and say, listen, I have a bit of jowling or I have a bit of redundancy. I don't want to have surgery. I don't want the expense of surgery. I don't want the downtime of surgery. And I certainly don't want the risks of surgery in terms of the marginal nerve. So there are opportunities for people who can do these non-surgical innovations to see results. And I think that for people who've already had a facelift and already had that type of laxity, and a couple years later, they're starting to see a little bit of fatigue of that tissue tightening, this is a great opportunity to use these technologies.
Yeah. That is so true, though. That is so true. And that's the great thing about lasers, right? There's always like something new coming up. And then you're also trying to reinvent uses for the existing technology and try and come up with new ways and innovative ways to try and use them. So that's great.
I so agree with you. Honestly, when people say to me and you at meetings, what should I get? What's the most innovative? If I had some money to spend on my practice, what should I get right now? I like to ask them what they already have, because in some cases, for some technologies, it's learn how to use the stuff you already own better. And as we know, Ultherapy has been out for a number of years. And, if you're not using it the way it was designed, so we've done several of the Ultherapy clinical trials, and if you're not using it with the pulses that you should be delivering, then of course people aren't going to get the results that they're looking for. And the problem, similar to laser hair removal, is somebody may call my office, somebody may call your office, and then compare that to some spa down the street where somebody doesn't necessarily have a lot of training on something, and maybe somebody does. But in terms of you need to be delivering this appropriate number of pulses, which is the appropriate number of energy that goes into the skin. And if you're not doing that, then your cost is much lower when you do the treatment, because that's a consumable, and therefore the cost you can quote over the phone is much lower. So that may bring people in for a procedure that's trying to make apples and apples comparisons between 2 different facilities. But the reality is it's a totally different treatment if you're not following the protocols and delivering the amount of energy. So even though it's cheaper, it's not going to be effective.
That is so true. Cheap is not necessarily always the best, nor is expensive the best. It really comes down to technicality and skill.
Totally agree.
Yeah. Now,
So, but
sorry, go ahead.
so in reference to, sometimes learning how to use the procedures you already own better, I do a tremendous amount of full field erbium resurfacing. And
Mm-hmm.
yes, I do this on patients of darker skin type as well. For, people who have significant acne scars and etching, you have to be very careful. But, the erbium resurfacing, like with the Cyton platform, is something that's been around for a long time. The real pioneers in this field are folks like Jay Burns and Jason Posner and Susie Kilmer, and I've learned a tremendous amount from them. But Khalil Khatri, who's up in New England, actually has published a lot on treating patients of Indian descent with this type of procedure for significant acne scars and scarring. And I think it can be a very safe and very effective tool for people. And that technology really hasn't changed much over the years. So even though we've moved to fractional technology for many things, I actually still use a ton of full field erbium. And in many cases, I do a combo of full field erbium and then fractional erbium, or full field erbium and fractional CO2. And I think it's important, if we're treating acne scars, there's certain things we can do. For instance, with acne scars, I'll treat somebody with fractional erbium. And fractional erbium doesn't have the coagulation when you're delivering these holes into the skin. So you can topically apply certain things that aren't able to effectively cross over. Jill Weibel has done some important work, and Vic Ross as well. But if you topically applied Sculptra, then you can get some of that into the little columns, right? But I still use full field erbium on some of the shoulders of these lesions. If you think about like a rolling scar, I'll still use erbium around that. And, there's time for fractional and there's a time for full field. And certainly there's plenty of opportunity to do a combination of things, whether, we incorporate subcision using a little needle with a little blade at the end to sort of free up the bands that pull things down. And I always explain that to people, if whether we're talking about acne scars or we're talking about cellulite, if you're using subcision where you have the ability to cut sort of the band that's pulling something down, if we think of like an old-fashioned couch and it has these buttons on it and these buttons are pulling down, if we release the button, it'll lift up. It may not lift up even with the adjacent couch, but it's certainly going to lift up because the button's not there anymore. So that's effectively what we're doing. And that's important that we do that in combination with other things. Murad Alam, who is, done some really innovative work, published several years ago in 2005 in dermatologic surgery, really the importance of subcision. And that's regardless of skin type, and it works really well for people.
Yeah, I'm a huge believer in subcision. Like, I will not even start treating them with lasers till I've subcised them, if the scarring is medium to severe type, because I always feel that it's so important to release those adhesions and to get some kind of stimulation going in the skin so that when you use the laser, it does give me better results.
I agree. And, sometimes patients come in and they actually, they're in from school, for summer vacation. They don't have the ability to come in multiple times, but yet they're going to be around for, a month or so you can keep an eye on them. There are times where we do these sort of mega sessions where I will do subcision on the same day as, fractional erbium with laser assisted drug delivery. And then I'll do some full field erbium. And then in some areas, I may do some cross technique with TCA, and then watch these patients, make sure they're not getting sun exposure, and be very careful in their post-procedure follow-up. And one of the things that's really been tough during COVID is, even though many people come in and they're willing to do downtime procedures because they don't have any social events. Like, I don't have any plans tonight. My family doesn't have any plans tonight. We're not hanging out with people. I'm not going to the theater or to the movies or anywhere. So for many people, this is the time they want to do things, but nevertheless, they need to realize that they have to be so careful. If somebody, has these procedures with us, then they're a risk of infection. And I get people come in and they want to use their own mask that, oh, I really like this mask. I like it the way it fits and covers up things. But, I have to tell them, you've got your nasal secretions, you've got your mouth secretions, you've got the makeup from this morning, and all that gunk is on your mask. and I just resurfaced your face. So I know you want to get out of the office and get home, but I need to give you a fresh mask because I don't want you to contaminate. And they're kind of, so I said, you have to think about everything to that level. It's super important.
That is very true. We actually have a question asking, what is the cause of blisters during HIFU?
You know, blisters during HIFU can happen. I personally haven't seen it. You know, sometimes it's using what we call bulk heating, where, you know, when you deliver a pulse to an area, you know, unless you go to the next area, or if you're using really truly high settings and you're exceeding a certain temperature, you can have injury to the surface of the skin. But when you're doing these pulses, you're going like this, and then this, and then this, and you're following the course of the handpiece. So that's something that is extremely rare, and I personally haven't seen it in anybody that's been treated in my practice. Have you?
I haven't seen blisters, honestly, till now. I've been using therapy for about 4 years now, but I've not had any blistering. But, you know, I do know that if you overheat, like if your joules per setting was very high, and if you overlap too much in the same area, instead of moving along, you can always, like Joel said, get that bulk heating. And I also think that people with less subcutaneous fat, if they have really thin skin, could probably get this, probably because the heat is not disseminated as well as in a person who has a bulkier face. I think, and also if it's a bony, ridgy area, I think that's where you could probably get into trouble.
And I think, you know, with therapy, there are 3 different depths you can go. And I think it's more likely if you had an injury to the surface that you were using the 1.5 millimeter handpiece, which is just going quite shallow. But I always tell people when we're talking about, you know, heat-related injuries and blisters that it's 3 things. First of all, it's too high a setting, or secondly, it's pulse stacking, you're not moving, or it's too many passes. And all 3 sort of aggregate, in some cases it's all 3, to too much heat in one very specific area, causing that injury.
Agreed. I totally agree. There's another good question. How do you do your subcision?
So, you know, subcision is a really interesting thing. It's one of these very simple things to do, but it almost looks like barbaric. And
it does.
You know, Doris Hexel, who's a good buddy of both of ours, has really been the pioneer. She's in Brazil worldwide of subcision. So, you know, for subcision, I like to use an 18 gauge no core needle, NOKOR. And basically it's an 18 gauge needle. And at the very end of it, it has a very small 11 blade. And, you know, so if I'm subcising an area, then what I like to do is do a little bit of anesthesia. Once I mark out the area and know exactly where I want to subcise, do a little bit of injected anesthesia, put it in there, just a little bit, cause a little bit of a blanch. And then I pop it in adjacent to it. And then I do a windshield wiper movement in the deep dermis. I'm actually using that windshield wiper movement. It's important that it's in the deep dermis and not really, really deep, because if you're super deep, then you're actually not able to sort of break up that band. So you want to think about where the issue is. And if you look under a microscope and see where some of these acne scars are, you know, you get a sense of really where that's taking place. And then you windshield wiper it. And the lidocaine with epinephrine helps it from bleeding, because, you know, an 18 gauge needle is a bit of a hole in the skin. But afterwards, and after we finish, you know, I like to actually put on a little aluminum chloride to stop the bleeding. And then, you know, and then a little cotton ball with some tape, and you can sort of press it, you know, and in some cases you use a little Telfa pad under that, but that pressure helps decrease some of the bleeding, you know, because you want actually some bleeding underneath to lift it up so that you don't recapitulate that band.
Agreed. Very true. I do something similar too, actually. In fact, I actually sometimes just give them a dental block, so their entire cheek is numb, instead of going in to give local at certain areas. And only if it's like a really like an ice picky deep scar, I'll do that to lift up the surface so that I can just get under the scar.
I totally agree on the dental block, the infraorbital block. and, the mental block. I think
Yes.
the issue is for some of these people, they just have very focal areas. And that's kind of what I was referring to, is individually numb that up. But, if
Right.
people have a lot of them, you're right. Like you really have to numb them up. And the area that it's hard to numb up like that is in front of the cheek. So I typically, in front of the ear, I typically supplement that a little bit. But, there's people who've got, 5 spots that I'm releasing on the cheek.
Yeah.
And then you're talking about people who've got, 35 spots on the cheek.
Yeah, that's true. So is there any treatment for stretch marks? Ooh, that's a question that's just popped up.
Stretch marks are really an interesting and tough, treatment. And, honestly, we talked about the toughest thing that we encounter with melasma on this segment. So
Yeah.
let's hit something, that's also tough for us. I don't know what you do. I subdivide these to acute, so some very recent stretch marks, like somebody who was, pregnant a couple months ago and they're done
And
nursing.
it's still red.
And it's still red. Then, we can use pulse dye laser for these patients. And if they're not nursing, I'll use a topical retinoid, and I'll also use a silicone topical formulation, and I'll do non-ablative fractional laser. If people don't have non-ablative fractional laser, you can do some microneedling. For people who have longer standing stretch marks that are whiter, those are more difficult to treat. And I don't, overpromise these people at all. And those are really tough, especially if they're white and they're really, their width is pretty significant. So for those people, it's really a combination of many things where we use non-ablative fractional lasers or microneedling. I like to do a little bit of ablative laser because I think that helps with the texture a bit. And then there are very, very, very dilute fillers that people can use for that. And I think we're going to hear more on that topic, because one of the companies has actually purchased a technology that they're looking, specifically at the treatment of stretch marks with it. And it's pretty exciting. I think that we're going to get better, especially for those whiter, wider, more difficult to treat ones in the next couple of years. What about you?
So, if they have the reddish marks, it's usually red or brownish in color in the early stages. I get great results with it. I use like resurfacing lasers, microneedling, PRP, etc. for that, and that gives us results. But if they've turned white, nothing really shakes them, because they get even more whiter as you're treating them. And so if the skin is colored, you start getting these strips of shiny white lines, and it doesn't look so great. So I always tell my patients that if you've got red or pink, come right away and I can help you clean that up. But if it's turned white, or if it's more than 6 months old, learn to live with it, because the technology is still not out that can give you results that you're going to be happy with.
I so agree. I'm excited about this new, injectable that may actually change things for people. That's pretty cool.
Yeah, it would be really good if things could change. I mean, I think that's one area that still needs a lot of work. Stretch marks for sure.
Agree with you. I'm glad you mentioned PRP, because that is one of the things that I'm so interested in. I wrote an article recently with Deirdre Hooper. But I like to use PRP after laser resurfacing. We use it after microneedling to facilitate healing. And there actually is some data about that, making things like 15% less red, less swollen, less pain after procedure. And now there's actually some information about using it sort of to be synergistic with the procedure, sort of add the growth factors that your body depends on to turn on these different pathways. And for some of that's topical application. And some of these studies, as you know, and you alluded to before, with injecting very focally, you can inject the PRP very focally as well, especially with acne scars. So how do you use it in your practice, aside from alopecia, which, I think we all do?
Yeah, alopecia, I think everybody uses that. But acne scars, we use it for every single acne scar patient of mine. So we'll do a substitution, we'll do some hydration, and then we start the laser. So with each session of laser, we space those laser sessions about 4 to 6 weeks apart. And with each session, we actually use PRP. And if it's like a fractional laser, then we'll actually inject the PRP after the fractional laser. If it's a microneedling device, then we'll apply it topically because, you know, with the microneedling anyway, we've created the pores in there with the radio frequency microneedling device when it's 2.5 and 3 millimeter depth. So we'll just apply it topically in that. So this is something that we commonly use for all of this. I also like using it for skin regeneration, just the surface. So if we're treating somebody and we're doing photofacials for them, right? So
Right.
once in 3 months, I like to add a little bit of PRP into their skin, like you know, it was very popular a long time ago as vampire facial lifts, but we use that and then we inject it into the skin, the face and the neck area, and it gives them a nice sheen and like a healthy texture to the skin.
You know, and I think it's such an important tool that we can use in combination with various things. And, you know, patients, they know typically if they're a hard blood draw. So I always tell people, drink so much water, just have so much volume that it's okay if you have to go to the bathroom between the blood draw and when we do the procedure. But we really need you to have good veins.
Yes, otherwise it's so hard to draw that blood and you're just poking them to get the blood out and then they just get a turn off from that. But yeah, and I tell them don't drink alcohol the night before. The reason is that I've always seen that people, if they drink alcohol the night before the procedure, they're more dehydrated and their veins shrink. It's always harder to draw the blood out.
That's such a great thought. Yeah, we need to start doing that as well. Thanks.
That's great. There was another question for us a little earlier asking how do you use retinol in your practice?
You know, I'm a big topical retinoid user. So there was a New York Times article I was in a few years ago, and then a Consumer Reports article I was just in July talking about retinoids. Really, in most cases, it's the best evidence-based topical that we have. And University of Michigan has done some really compelling data that it doesn't have to be high concentration retinoids. And, you know, you really want to just activate these receptors. You don't have to get what we call retinoid dermatitis. You don't have to get irritated and dry. You know, so getting people comfortable with using a retinoid, they may start with retinol and they don't need to go up to the point where they push it. Some people are oily and they can tolerate it. Some people are dry and they can't. They just should use it. And, you know, we tell people to use it at night because it is inactivated in the light. And it's important, you know, that they use it just before bedtime. But you will see some improvement in lines and wrinkles and pore sizes from continued use of it. Certainly decrease in some of the sebaceous activity and opening up with some of the pores so that people have less acne. So, you know, honestly, it just leads to more collagen growth. It sort of inactivates the matrix metalloproteinase, as we call it, like collagenase, and allows the skin with long-term use to get thicker. How do you use it?
Pretty much the same. I always tell people that if you're over 30, you should be on retinol for your skin because after 30 is when you really start seeing, at least in Indian skin, we start seeing the visible signs like the pores start opening up, you start seeing the finer lines, you start seeing that dullness getting into your skin, and you start seeing surface textural and pigment changes. So I always ask them to put retinol at night as part of their skincare routine. Always. And then, of course, if somebody is on treatment for acne scars, I will ask them to use it, but discontinue it for 3 days before the procedure and for 3 days after the procedure. But this is typically how I use it. And I use a 0.5 is what I use typically.
So we have so much acne in this country, and you know, and I think there's a lot of acne across the world, and people don't realize that, you know, it's most of the time there's very little they can do. It's genetic, you know, but we certainly know hormones are a trigger, and we start seeing it in adolescence. And married to a pediatrician, you know, that's something that we talk about. And then lastly, there's been some very recent evidence, as you know, about foods that are high in sugars. So high glycemic foods, things that contain whey protein, you know, from a perspective of milk containing products that may have other hormonal factors. So, you know, all three of those things sort of in combination means that we see a lot of acne as dermatologists, and we start people on retinoids for acne at a very young age. So when we start seeing adolescents, it's really the first thing that we're saying. If you look at the American Academy of Dermatology's treatment algorithm, in every column for acne,
it's like retinoid.
So you know, people in our practice will start retinoids in their teen years, and you know, the hard part is getting them to continue using it when they're not pregnant or nursing, but getting them to continue using it to the point where, you know, you're talking about in their 30s, where their pores are changing and they notice the skin quality changes. So, you know, if they're using it for acne early on, we just sort of need to find a way to make this work and tailor to their skin type, whether it's oily or dry, where they live, because we don't have a lot of moisture here in the mountains. And you know, people at sea level may be able to tolerate more specific formulations.
That is very true, actually. Yeah, we use retinoids for acne too, quite often here. But again, we coach them that if you're using a retinoid, you're going to have to use the sunscreen to maintain your skin. Otherwise, you can get sensitized to the sun.
So, you know, I think people realize that, you know, the sun makes you dry and red, and retinoids make you dry and red, you know, but, you know, you need to find a way to avoid the sun, protect against the sun, so you don't get dry and red from that, and just sort of deal with the retinoid use. And that's a hard thing for people. In Colorado and Denver specifically, we have 320 days of sunshine. So people don't realize that. So in some parts of the world, they say to people, well, you know, in the summertime, you know, watch out because you're outdoors more. But we have people who may spend a lot more time outdoors in the winter because they ski, or they, you know, or they're doing, you know, snowboarding activities and mountain climbing. And we just have to ask them, you know, what's their seasons for biggest sun exposure, and adjust things accordingly.
Excellent, Joel. And I think shortly Instagram's going to cut us off because we're almost an hour into a conversation here.
It's been so much fun.
It has, and I don't know how the time flew, but thank you so much for joining me today, Joel. And you take care, stay safe, stay healthy, and I'll connect with you offline soon.
Sounds good. Thank you, my friend. It's been a lot of fun.
Thank you, Joel. Thank you so much. So that was my friend Joel, who joined us all the way from Denver, Colorado today. One of the top dermatologists in the US and an expert on everything laser. So Joel has valuable tips to give us, but our takeaway home from this is that you should customize the laser procedures and the treatments to suit your practice and your patients. And also sunscreen is a critical component of skincare, and so is retinol. Thank you for joining me this Saturday. Stay safe, stay healthy, and I'll see you next Saturday on my Saturday night live sessions. Bye-bye.